Hello, my name is Larry Dobrow. I'm the senior editor of MM+M. I'm here today with Jennifer Fillman, who is the vice president and general manager of specialty services at Cardinal Health. Jennifer, thanks so much for being here today.
Thank you so much for having me.
First question, kind of a nice non-broad one. What are the biggest challenges in applying data and analytics to improving healthcare access?
One of the biggest challenges, I think, is the amount of data. So there is no shortage to access of data at the pharmaceutical companies. They sit on top of mountains and mountains of data. The issue is, how do you organize that to glean insights from it? And so they need to start thinking about tools and how to organize that to make it actionable, to remove those barriers to access. Yeah, one really great way that they can bring that together is if they're using a patient services hub or hub service provider for their patient services, the hub provider can actually do some of that for them. So if they start to think about what do they want to do with the data, how do they want to use it? Do they want to drive reimbursement strategy? Do they want to look at market access strategy? Do they want to gather information for future regulatory filings? So start thinking about what they want to do with it, and then utilize their hub provider to do that. And as they're selecting a hub provider, or maybe even switching providers, some of the things that they would want to look at are, what types of data platform does that hub provider use? What do the reports and analytics, do they have dashboards? Timeliness of the data that they're sending out and serving up for the pharmaceutical company. Is it available nearly real time? So lots of considerations.
How can drug makers use data and analytics to better engage with patients and influence behavior, such as adherence?
Yeah, adherence is a great area where they can influence behavior because it's a very measurable outcome. You can use validated tools to start to segment your patient population. So not all patients will react to adherence programs in the same way. So there are validated instruments out there where you could stratify patients by their risk of adherence. So a riskier patient for adherence, you may need more interventions with, and you might want more touch points with that patient versus a patient you've deemed low risk, who understands their medication, knows why they're taking it, gets their prescriptions filled, has relatively low barriers to access. You might not need to touch base with that patient as often. So if you segment your patients, then you can start to look at things like ensuring that all of those patients have an adequate medication possession ratio. Because it's been proven and been studied and even been published out of hub services that higher medication possession ratio, meaning the patient has the med in their hands and available. They've gotten the prescription refilled, the med is available for them to take, that they are more adherent.
Okay. One last question for you. How else could pharma companies leverage their data from the patient services hub that you talked about already? For example, could it be used as part of maybe a patient-reported outcome study?
Absolutely, and I think that's a great way to use the hub data. So hubs are a real great source of data because they sit between the payer, the patient, the physician, and the pharmacy. So they've got data sources coming in all over the place. So again, I think that the company needs to start with, what are their objectives? What do they want to do with this information? Do they want to work on their reimbursement strategy, refine their commercial efforts, look at market access strategy? There's a number of different objectives. Once you understand the endpoint and the objective, then you can craft the study and make sure that your hub is collecting that data for you. So for one example might be using a lot of validated instruments in the place are survey tools. So you can have your hub implement those in their platform, and when they're on the phone with the patient, they can administer the survey through the validated tool. And then there's a great way to collect information. Then you can complete and publish studies on it. Once you've published a study, then you've got that information available as another vehicle for you out in the public domain.
Jennifer, thanks so much for being with us here today. Really appreciate it.
Great, thank you. Thanks for having me.
Absolutely. My name is Larry Dobrow from MM+M. Thanks again.